The man practices suturing 100 bananas every day, only to hone his skills in sewing up ruptured testicles, so he volunteers to work the night shift in the emergency department. This is because such patients usually first appear in the emergency department, and he even specifically asks the nurse to notify him immediately if there's a patient with a ruptured testicle. The nurses are instantly smitten, thinking that handsome men always have unique aspirations. But Ling Ran waits all night and doesn't encounter such a patient, so he decides to return to his clinic. Unexpectedly, before he can rest, he receives a call from Lu Jingling. She has brought a group of patients to the hospital early in the morning, only to find that Ling Ran is already off duty. She has gone through the trouble of gathering a group of patients, so should she just hand them over to another doctor? Ling Ran's father disapproves and suggests bringing them to the clinic instead. Not wanting to waste resources, she brings a carload of people to the clinic in just 10 minutes. As soon as she arrives, she urges the patients to hurry inside. When she enters and sees Ling Ran still playing a game, she immediately gives her subordinates a cold stare, scaring them to stay outside. Ling Ran quickly reassures them, inviting the patients to come in the clinic. He changes into his work clothes and asks the patients to form a line to enter. The wound treatment goes smoothly. However, Ling Ran finds it strange that each wound is perfectly made, requiring only simple cleaning and suturing. Just as he's puzzled, a patient interrupts his thoughts, asking Ling Ran to suture him haphazardly. The patient has been called effeminate since childhood and wants a large, prominent scar to make himself look more courageous and strong. Although the request is unusual, Ling Ran obliges and sutures a similar scar. To his surprise, the system rewards him with a patient gratitude reward, a beginner's treasure chest. He expects it to contain more energy but instead finds a master-level suturing technique. This technique, proposed by Professor Tang Jinbo of National University in China, is specifically used for repairing severed finger tendons. Ling Ran is overjoyed, as tendon repair, although just one of many hand tissues, is considered one of the most challenging surgeries in the field. However, his joy is interrupted by an argument between a female patient with a shoulder injury and Dr. Xiong. The patient wants to use a fine thread for suturing to avoid scarring, but Dr. Xiong disagrees, saying that he can only operate with a size 0 thread, and using anything finer would be too difficult to control. As the standoff continues, Ling Ran steps in to help, offering to perform the suturing himself. He asks the nurse to fetch a 5-0 suture, and Dr. Xiong thinks he's joking. However, in Ling Ran's hands, there's no difference between a 5-0 suture and a size 0 suture. He quickly and skillfully sutures the wound, leaving a barely noticeable scar. The woman is very satisfied and promises to recommend the clinic to her friends. Ling Ran's father is overjoyed, believing that if Ling Ran stays at the clinic, they would be wealthy. But Ling Ran isn't interested and returns to the hospital the next day. As soon as he changes into his work clothes, he receives a notification that there has been a car accident on the highway, and injured patients are being rushed to the operating room. Dr. Zhao asks him to come immediately. It turns out that most of the emergency department doctors haven't arrived yet, leaving only Dr. Zhao and 2 resident physicians. Their skills aren't as good as Ling Ran's, so Dr. Zhao decides to let Ling Ran take charge. Everyone is shocked, how can an intern be in charge? But before they can object, the patients are brought in. Dr. Zhao immediately begins the surgery, starting with stopping the bleeding. Ling Ran suddenly wonders if his perfect bare-handed hemostasis is already the strongest in the world. The system displays a ranking, 138th in the world, 13th in the country, 2nd in Changsha province, and 1st in Yunhua city. Ling Ran is taken aback, realizing there are people more skilled than him in the province. Distracted by this revelation, he forgets to stop the patient's bleeding. The moment Dr. Zhao cuts the tourniquet, blood gushes from the wound. Dr. Zhao quickly reminds Ling Ran to apply pressure with gauze, but Ling Ran instinctively uses his hand instead, quickly stopping the bleeding. However, Dr. Zhao still reminds him that no matter how good his skills are, he can't afford to be distracted during surgery. From then on, Ling Ran fully focuses on the surgery, making it go much more smoothly. Although Dr. Zhao doesn't particularly like Ling Ran, he can't deny that Ling Ran's skills are on par with many experienced doctors. After suturing the leg wound, Dr. Zhao entrusts Ling Ran with the entire arm. However, he doesn't realize that this decision will soon cause significant trouble. The patient's wound is bleeding profusely, but the intern presses on it with his hand, startling the chief surgeon. However, the bleeding quickly stops. It turns out he is using a barehanded hemostasis technique. In the entire Changsha province, only 2 people are this skilled, one being an expert in surgery, and Ling Ran is just an intern. After witnessing Ling Ran's skill, the chief surgeon decides to let him suture the patient's arm, but soon realizes something is wrong. He questions Ling Ran on why he is wearing a microscope since it is only used for suturing torn tendons in the hand. Suturing tendons is a violation of orthopedic regulations, and the chief surgeon would be fully responsible. He hurries to stop Ling Ran. However, Ling Ran has already begun suturing, using a layering technique. If interrupted midway, the patient's tendon damage would be unavoidable, possibly resulting in loss of hand function, which would be a medical accident. Dr. Zhao is alarmed as tendons in the hand are divided into 5 regions, and the patient's injured second region is called the no man's land because early on, there were virtually no methods to heal the damage in this area until Professor Tang Jing from Nantong University in Jiangsu created the heavenly method of suturing. In the entire Yunhua hospital, only the head of orthopedics, Director Pan, knows this technique, so these types of patients would be transferred to orthopedics. Now that an intern like Ling Ran knows it, Dr. Zhao doesn't dare interrupt and quickly sends an assistant to fetch Director Hua. They initially think Ling Ran will be scolded, but Director Hua just asks, "Ling Ran, do you know you are violating regulations now?" Ling Ran nods, "I know now, but I didn't before I started." Dr. Zhao said he's entrusting the entire arm to me. Now it's Dr. Zhao's turn to break out in a cold sweat, but Director Hua doesn't comment and quickly puts on a microscope to check Ling Ran's suturing. Although he doesn't contribute, he understands. After confirming that the suture edges are neat and secure and the surrounding damage is minimal, he finally breathes a sigh of relief. Dr. Zhao suggests that after suturing this part, the rest should be handed over to orthopedics. However, Director Hua is unhappy. "If our emergency department can do it, why should we give it to them?" Dr. Zhao then remembers that Director Hua is a pioneer of promoting the concept of a versatile emergency physician in China, which means making the emergency department capable of handling all kinds of cases so that patients don't have to be transferred between multiple departments. In the past, when surgeons didn't make money from surgeries, the emergency department could snatch some surgeries. However, since medical reforms, surgery fees have increased nearly tenfold, and surgeons are rushing to perform surgeries, making it difficult for the emergency department to perform better surgeries. Now that they have Ling Ran, an intern who even knows the layering technique, Director Hua is sure to keep him. Sure enough, the next second, he drives the other doctors from different departments out and starts talking to Ling Ran. "Ling Ran, I have to criticize you first. This is the second time you have acted privately and disregarded discipline. If we handle this publicly, let alone becoming a doctor, you won't even get your graduation certificate. So you must take this as a warning. As a punishment, I will extend your internship." Just now, I asked the head nurse to check, and there have been more than 30 patients with flexor tendon injuries in the hospital in the past 3 months, which means there is 1 case every 3 days. So, these patients will be handed over to you from now on. Dr. Zhao's mind races, thinking this is a punishment, but for an intern, isn't this a great benefit? But soon, he realizes that Ling Ran cannot be the chief surgeon, so there must be a chief surgeon present to authorize it, and isn't that person himself? If they perform the heavenly method suturing every month, by the year-end summary meeting, they can add a line saying, "Completed more than 120 heavenly method sutures throughout the year, creating a new national record for emergency departments." He would be successful then. Thinking about this, he hurries to check the suturing, fearing Ling Ran might make a mistake. Before long, the surgery is successfully completed. When the patient wakes up, Director Hua immediately calls the head of hand surgery, Director Wang, ostensibly for a consultation, but actually to have him recognize Ling Ran's skills so that they can take tendon injury patients from hand surgery. Upon seeing the patient, Director Wang is shocked, it's actually the heavenly method suturing. So he calls a few hand surgeons over to assess the patient's hand function. They ask the patient to move each finger individually, then perform fingertip pinching, finger pad pinching, and lateral pinching. Finally, they conclude that the recovery effect in 1 week is comparable to the usual 3-week results. This forces the famously strict Director Wang to praise Ling Ran, and he changes his address from Ling Ran's name to Dr. Lin, which is the highest recognition for an intern. Director Hua's plan is successfully executed. Soon, 2 months pass, and Ling Ran masters the use of the heavenly method suturing. Director Hua then assigns him a doctor who just completed training to be his apprentice. As an intern doctor, Ling Ran stitches up 100 pigs' feet every day at the hospital, but this practice earns him a formal doctor as an apprentice. It turns out he's practicing a special hand-stitching technique called heavenly suture. In the entire hospital, only one chief surgeon knows it, so emergency department doctors who want to learn come to Ling Ran. Before officially teaching, Ling Ran demonstrates the technique on pigs' feet several times. At first, Lu Wenbing looks down on Ling Ran, the intern, but after watching the whole process, he is amazed by his skill, comparable to the chief surgeon. If Lu Wenbing could learn this technique, he would undoubtedly become the backbone of the emergency department. After watching Ling Ran demonstrate the process a few times, he's eager to practice himself. However, at that moment, a nurse informs them that they need to perform a hand suture, so Ling Ran heads over. Because he is an intern, the chief surgeon, Director Ho, is still in charge, but he lets Ling Ran handle the primary suturing work. This time, though, Director Ho directly gives the chief surgeon's responsibilities to Ling Ran. The patient's thumb has been pierced by a knife blade, which needs to be removed by making an incision on the side of the thumb. It takes Ling Ran 4 to 5 minutes to make the incision, and he even feels it's too short and makes a second cut, which is quite embarrassing for a chief surgeon. Confused, Director Ho watches Ling Ran struggle. Little does he know, Ling Ran's system only rewards him with a few suture techniques, and his skill in other areas remains at the level of an intern. Just as Ling Ran panics, the system suddenly gives him a task to treat the patient and awards him a precision cutting skill, which is like adding fuel to the fire. However, this time he has to complete the task himself. Once the incision is made, Ling Ran quickly regains his composure and demonstrates his impressive suturing skills, leaving Lu Wenbing dumbfounded. Lu Wenbing thought he had learned something earlier but now realizes that the real suturing process is many times more complicated. He doesn't even dare to blink, afraid of missing any details. After all, they don't get to perform this type of surgery every day. 2 hours later, the surgery is successfully completed, and an excited Lu Wenbing wants to continue practicing with Ling Ran. However, Ling Ran shakes his head and says it's time for him to teach Ling Ran how to write medical records. Stunned, Lu Wenbing asks how it is possible for Ling Ran to have never written a medical record after so many surgeries. It turns out that Ling Ran has been busy with cleaning wounds, suturing, and performing heavenly sutures, leaving the medical records to other interns. Feeling wronged, Lu Wenbing realizes that even as a resident doctor, he hasn't had an intern to assist him, while Ling Ran, an intern himself, has had help. After finishing the medical records, Director Ho takes Ling Ran to a dinner party hosted by the business manager of Changxi Pharmaceutical Company, Xie Han. The main guest is not Director Ho but Dean Zhou of Yunhua Hospital. Xie Han had heard about the genius doctor in the emergency department, Ling Ran, who had performed dozens of heavenly sutures in a month. Heavenly sutures require MRI equipment, and the entire Yunhua Hospital has only one located in the technology building, which is quite inconvenient for travel. If Ling Ran forms a team in the future, they could perform several years' worth of surgeries in a single day, and one MRI machine definitely won't be enough. Director Ho quickly checks and confirms that it is indeed possible. Dean Zhou immediately understands that they have come to ask her for funding, but she doesn't agree. Because even a domestically produced MRI machine starts at 3 million yuan, and better imported ones cost over 10 million yuan. Just having an intern as a bargaining chip won't work. Director Ho is not happy about this. When Director Pan was learning about the Constitution, he frequently invited experts to perform surgeries at their hospital, and now he has gone to study abroad, spending at least a few million yuan in public funds. Ling Ran doesn't need all those fancy studies, and the money saved would be more than enough for an MRI machine. After continuous lobbying from the three parties, Dean Zhou finally relents next week and agrees to renovate a surgery room for the emergency department first. However, the MRI machine depends on the emergency department's future performance. Director Ho is overjoyed because he never intended to succeed in one go. As long as Dean Zhou sets the conditions, the MRI machine is just a matter of time. After the dinner party, as soon as Ling Ran returns to the hospital's duty room, Lu Wenbing rushes in, saying that the patient Ling Ran wanted to treat has arrived. The previously sleepy Ling Ran is suddenly energized and rushes to the patient's room. It turns out that he wants to try a new technique for suturing a ruptured wound. A man playing skateboard stunts in the park crashes into a railing. The intern examines him and tells him that he might need to have his hand amputated, scaring the man green. The resident doctor quickly reminds Ling Ran to consider the patient's condition, and if the hand is twisted, surgery is needed, only if it can't be recovered will amputation be necessary. After examination, Ling Ran confirms that the patient's bones are intact, so all that's needed is wound cleaning and suturing, which is quite simple for him. In just 5 minutes, the task of treating the patient is completed, and he receives a reward for his cutting expertise. Just then, a patient with a torn finger needs surgery. Lu Wenbing suggests that he should perform the surgery, as it would be too embarrassing if he has to cut twice again. However, Ling Ran shakes his head and takes the scalpel from the nurse to start the operation. Director Ho, who was about to speak, holds back his words because he is the chief surgeon, and usually, the act of cutting is a reward for junior doctors from their seniors. But Ling Ran starts the surgery without his permission. He doesn't stop him, though, because there will be many surgeries in the future, and Ling Ran can't always rely on others for the initial cut. But the next moment, he is astonished. Ling Ran skillfully makes a single, clean cut, reaching the level of a senior doctor. Director Ho, incredulous, asks if Ling Ran has been practicing cutting recently. Ling Ran can only give a vague answer. However, it's only been a short time since his last surgery, and his rapid improvement is astounding. If not for his previous poor performance, Ling Ran would be considered a genius who must stay in the emergency department. He suggests giving Ling Ran a raise, as the monthly intern stipend of a few hundred yuan isn't even enough to buy pig's trotters for practice. But since Ling Ran doesn't have a medical qualification certificate, the surgeries are registered under Lu Wenbing's name, and the surgery fees are transferred to Ling Ran through his card. Lu Wenbing is envious, wondering if this is the treatment for learning the advanced suturing technique. Soon, 2 hours pass, and Ling Ran successfully completes the surgery. Director Ho checks the time and finds that the surgery took only 2.5 hours. Despite the surgery being more complex than before, it took less time, indicating that Ling Ran is becoming more skilled. After the surgery, Director Ho asks Dr. Zhou to transfer all Ling Ran's previous surgeries. He also explains the calculation of surgery fees. For example, the surgery Ling Ran performed today, according to the Pricing Bureau's standards, the hospital receives 1,550 yuan per surgery. The emergency department receives 777 yuan from the first allocation, and the chief surgeon receives 518 yuan from the second allocation. Ling Ran can now earn 518 yuan per surgery, which is already the standard for a senior attending physician. However, Ling Ran is not satisfied and calculates that if he performs 3 surgeries a day, he can make 40,000 yuan a month. Dr. Zhou listens with a headache, as even 20 surgeries a month would be a lot, let alone 90. While Ling Ran daydreams, the system pops up another task: for every 10 advanced sutures completed, he will receive a primary treasure chest. What more could he ask for? Ling Ran excitedly runs to the emergency department office where Director Ho happens to be, asking him to choose a few cases. It turns out that Director Ho had spread the word about the advanced suturing technique half a month ago, so many hospitals that couldn't perform it wanted to send their patients over. Ling Ran doesn't even look at the cases and says he wants them all. Director Ho doesn't think he's arrogant, as the first few sutures have allowed patients to move their limbs after just 24 hours, and the healing is beyond expectation, simply incredible. However, when Ling Ran says he wants to perform 5 surgeries a day, Director Ho becomes concerned and quickly reassures him that if he needs money, he can ask for it. But Ling Ran just wants to complete the task. After some negotiation, Director Ho agrees to let him perform 2 surgeries first. If all goes well, more patients will be scheduled for the next day. But as Director Ho is in a meeting, Ling Ran has to start the surgery under Lu Wenbing's name. By the time Director Ho arrives, the suturing is finished, and this time it only took 2 hours. He quickly checks the wound to confirm that the suturing is done correctly before breathing a sigh of relief. Then, with a smile, he points to the second patient already in the next operating room, telling Ling Ran he can go there now. To his surprise, the second surgery is not only better but also faster, taking less than 2 hours. It seems that performing multiple surgeries in a day is not just talk. So, Director Ho immediately contacts nearby hospitals to send over the next case. The man is just an intern, but he has the head of the emergency department assisting him. It turns out that Ling Ran has learned a highly difficult suturing technique, and he is the only intern in the entire Yunhua Hospital emergency department who knows it. So, Director Ho schedules 3 surgeries for him in a day. Ling Ran doesn't eat, drink, or use the restroom, completing all the surgeries in 7 hours and even asking Director Ho to prepare more for the next day. Lu Wenbing and the other assistants, who are helping, are terrified and exhausted by the workload. But before they can complain, a trainee doctor still comes to Ling Ran with fruit, hoping to assist in the surgeries. He has watched surgery videos for many days and is confident he can be a good assistant. Lu Wenbing, who has been listening in, becomes angry and doesn't want to give up his opportunity to learn the suturing technique, which is only possible if he assists Ling Ran. Just as the two sides are about to argue, Director Ho intervenes, saying there are more surgeries scheduled for the next day, so there's no need to fight. Still, Lu Wenbing is afraid of being replaced, so during the surgeries the next day, he purposely wears an adult diaper, vowing to keep up with the workload. But after the third surgery, the first nurse can't take it anymore and has to be replaced. Ling Ran looks at Lu Wenbing, who is also exhausted, and decides to take a half-hour break. He lets Lu Wenbing rest for a bit, reminding him to set an alarm. However, when he wakes up and rushes to the operating room, the fifth surgery is already wrapping up. The substitute assistant is the trainee doctor who brought fruit the day before, and Lu Wenbing feels betrayed. Ling Ran, on the other hand, is focused on the surgeries. After a few days of hard work, he completes 10 surgeries, earning a beginner's treasure chest. Expecting something related to energy, he opens it and finds an expert-level physical examination diagnosis skill. Physical examination is a fundamental diagnostic skill, which helps prevent diseases by using visual, tactile, and olfactory senses to judge a patient's condition. On the taxi ride back, the system informs Ling Ran that he is ranked 1128th in Yunhua Hospital's physical examination skills, and he only needs to perform 20 to 30 correct exams to advance in rank. So, Ling Ran eagerly practices on himself. As expected, everything is normal, but the taxi driver is frightened by his behavior, thinking he is a weirdo. After Ling Ran gets out of the taxi, the driver doesn't even want his money and speeds away, leaving Ling Ran standing in the wind. The next day is supposed to be a rest day, but many people come to the clinic for checkups. Ling Ran decides to test his new skill, and because he is good-looking, all the girls line up for his team. This leaves Dr. Miao, who was hired for the checkups, with nothing to do. Ling Ran has to give up his position, but when the girls see Dr. Miao, they turn and run away. To not hurt the clinic's business, Ling Ran can only conduct physical exams for the patients during his morning rounds the next day. When he returns to the office, he asks Lu Wenbing to prepare for the day's surgeries, but the trainee doctor is still hanging around. Dr. Lin, the latest issue of Chinese critical care medicine has your name in it. Upon opening it, they see it's about the previous case where Ling Ran performed a bloodless surgery. However, Ling Ran doesn't feel much joy, as he is only concerned about the reward from the system after completing the paper. Unlike before, this time the ultimate treasure chest reveals not a skill, but 3,000 instances of upper limb dissection experience. In the next moment, countless dissection images appear in his mind, an amount of information so vast that even a doctor might struggle to acquire it in a lifetime. Now, Ling Ran has obtained 6 skills just from using the system. Soon, today's surgical work begins, and as Ling Ran makes the incision, an anatomical image of the hand naturally appears in his mind, making his cuts more precise and smooth. Lu Wenbing and the others look on in surprise, as his progress is incredibly fast. Just then, the operating room door suddenly opens, and 6 or 7 people walk in. It turns out that Director Ho has brought doctors from other hospitals to observe the suturing technique. Upon seeing how young Ling Ran is, Director Bai from the Maternal and Child Health Hospital shows some doubt, asking, "Are you sure you didn't just bring an intern here to tease me?"